Hand preference has always been of interest to parents, teachers, and health professionals because of its importance in self-care tasks, handwriting skills in school, and future occupational choices. Hand preference emerges through a normal developmental process during the first 5 years of life. Developmentalists believe that this process is very important, with transitional skills at each age level leading to those at the next. Prerequisites include posture, which maintains the body in reference to its center of gravity and is the basis for all movement, body image, which provides a point of reference for all external spatial relationships, and finally, laterality, the awareness of left and right within the body. Hand preference is usually well established by 9 years of age. Many people believe that some learning problems in children may be caused by a delay of this process, traditionally described as mixed dominance, that is, inconsistency of handedness. Others believe that although inconsistent handedness has been associated with learning problems, it is not a cause and effect relationship. Instead, they believe that both are related to developmental delay and/or central nervous system pathology. Most individuals without disabilities prefer one hand for writing, but they can also be ambidextrous at times, alternating equally skillful hands during other activities, especially bilateral ones. For example, a right-hander and a left-hander are each using both hands in different ways, combining power and precision to hold the tape, pull and tear it, and apply it to the paper. This berry-picking activity also demonstrates how frequently we alternate hands for precision tasks. The choice of which hand will pick the berries while the other hand holds the branch depends on the interrelationships of the person, the objects, and the task requirements. Again, bilateralization, or being able to use both hands skillfully, provides us with a more balanced repertoire of adaptive behaviors. In fact, the choices we make to use one or both hands for different tasks are very complex, influenced by genetic, cultural, and environmental factors. Observations and analyses of these tasks can provide important information for understanding the issues surrounding hand preference and its practical relevance in children with and without disabilities. This study of unilateral, bilateral, and bimanual hand movements in typical elementary age children organizes the normal components of hand preference into 3 sections. Section 1, Exploratory and Sensory Movements, Section 2, Gestures, and Section 3, Functional Tasks. Functional tasks are grouped as 3A, power or resistive, 3B, precision or fine manipulation, and 3C, power and precision combination. Functional tasks are also grouped according to occupational performance areas, activities of daily living, work or productive activities, and play or leisure activities. Hand movements can be categorized as unilateral, bilateral, and bimanual. Unilateral is defined as one hand active, the other inactive. During this painting activity, the book is stable on the table, so the other hand rests in the lap, not needed to hold the book steady. However, at one point when the brush needs adjusting, this 5-year-old, who has not yet developed in-hand manipulation, brings in her other hand to help. In this case, the genetic factor determines which hand paints, but task materials and requirements dictate other hand choices, changing throughout the activity. Bilateral movements are defined as both hands used together doing the same thing symmetrically, such as opening a milk carton and using both hands to pour. Or one hand may be active as the other assists or stabilizes the object, as with this wind-up toy. Bimanual movements are defined as both hands used together, each hand doing something different. Factors which affect typing dexterity include somatosensory awareness, pressure, speed, and dissociation of fingers. The children in this videotape study include one apparent left-hander and 4 apparent right-hander, cousins from the same family. They range in age from 5 to 11 years and demonstrate examples of a wide variety of arm and hand skills needed for function in home, school, and community environments. Research studies have demonstrated familial contributions to handedness, but not always direct parent-offspring correlations fitting any simple Mendelian genetic pattern. In this family, the one 5-year-old left-hander has a left-handed mother, a right-handed father, and an 11-year-old right-handed sister. The 2 right-handed brothers, ages 8.5 and 11, have 2 left-handed parents, and this 6-year-old right-hander has 2 right-handed parents. Bowling begins with both hands steadying the ball, but the preferred hand usually rolls it. The preferred hand also records the scores. Sewing involves bimanual skills, inserting the needle into the fabric, which is held by the other hand, transferring fabric and needle to the opposite hands, and retrieving the needle, alternating hands.